Alright, so let us begin with today's Allen's keynote study streak. Welcome Dr. Suganeshwari, Hari Krishna, and few other viewers on YouTube. We are simultaneously live on Instagram and YouTube. So today we'll discuss a remedy which is in connected with the yesterday's remedy, which is Cicuta. The remedy we'll discuss today is Helleborus niger. Now, all these plant remedies have a deep action on the brain. If you go and investigate all the different plant remedies, their chemical components are so powerful that they make you delirious. If you are taking it for proving, or if you are seeing a patient, it will be more applicable to patients who are in a delirious state or who are in deeper states of the mind mental changes. So what we have in Helleborus is very interesting. The first line that reads, weakly delicate psoric children prone to brain troubles like the remedies belladonna, calcarea carb, tuberculinum with serious effusions. So all those cases where there are inflammatory changes in the brain or its surrounding tissues, it can be the cerebrospinal fluid, it can be the gray matter, the white matter, the pons, the medulla, the cerebellum, the cerebrum, all those areas, they, if they have some or the other SOL, or if they have more or less swellings due to some other tumors or swellings, this remedy, which is Helleborus niger, will work really well. And if you see, it is a ranunculaceae remedy. So ranunculaceae remedies like pulsatilla, staphysaria are more or less widely used in our practice. This is one of the extension of that remedy, that family, and we'll study in a little bit of details about Helleborus, about how it will help you in your practice. In mental generals, you see there are 3-4 lines mentioned, especially melancholy, weeful, despairing, silent with anguish after typhoid in girls at puberty, or when menses fail to return after appearing. So many times what happens is that in pubertal age, menarche, there will be menses in certain girls, certain female reproductive system will cause the appearance of menses, but after the first appearance or first 2 or 3 appearance, there will be a long gap, and then there will not be any other symptom which will be visible to you. Helleborus given to such patients will kind of correct that what do you say, the imbalance of the hormonal system on that level, and at least bring the menses, and then you can give your deeper acting constitutional medicine which will more be suited to the current state of the patient. So when menses fail to return in young girls at puberty, you should think of Helleborus very, 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 very strongly. In mind symptoms, we also have irritable, easily angered, consolation aggravates. Now, very similar presentation we are often prescribing Ignatia and Natramure. Sepia and Silica are also mentioned. Helleborus is one of the remedies. You shouldn't forget in patients who get aggravated by consolation, or when they are talked to in their anger state, they don't like those states of consolation. So you should think of giving Helleborus very strongly in such cases. Does not want to be disturbed. This is the next line mentioned in mental generals. When it is mentioned that the patient does not like to be communicated, does not want to be disturbed, it means that the mind is very sensitive to getting disturbed, especially when the emotions are stirred up. and that is what you see in Helleborus, in Gelsemium, in Natramir. All these three remedies, they do not want to be disturbed when they are angered or when they are at dis-ease, and that is what we should aim at when we want to prescribe these remedies. Unconscious, stupid answers slowly when questioned, a picture of acute idiocy. Now, I'll remember a very beautiful case. This was much beginning in my practice, and this was, a lady who was suffering from some gastric disturbances. But when I went to her home, because she couldn't walk too much, she was obese, and she used to, she was sitting on her bed, and when I saw her, I asked her, because they were known to me, I knew her name, so I asked her what is happening, and she was thinking, I have pain in my abdomen. So she's thinking long, she's thinking long, and is a kind of a acute idiocy which appears on her face. This made me prescribe Helleborus, and she was out of the entire problem. So you can see, unconscious, stupid, answer slowly when questioned. This factor, when you see in the patients, when we ask them something and they take time to think and reply to it, that should be your prescription for Helleborus. You will not get Helleborus who is, showing you a lot of shrieking, shouting, so poor asleep, etc., etc., which are the next lines mentioned. But you will also get someone who is having these subtle observations that you will need to do for their behavior, which will make you think of giving Helleborus very strongly. Patients who will be talking too much, fast talking, argentum nitricum, medorinum, heparsuf. By their words itself, you should be able to at least note the observations, if not the remedies. If you note the remedies, it will make you prejudiced. But if you note the observations, at the end of your case analysis, you can go back to these observations, and you can correlate with what all is said in the entire case and try to match the picture. There are few places that you need to observe, and I'm thinking since the last few days about how I should be telling you when and what you should observe. Number one observation you should do is when the patient enters. Number two, when he starts telling the complaints. After that, he starts, there is not much of an observation, but there will be some symptoms here and there that he will describe that you will need to pay attention to. After few minutes of your case taking, you will make a note of how the patient has behaved so far from the start of his entry to the clinic and the entire 5-7 lines of the symptoms that he has mentioned. And then when you go to mind symptoms, you make a note of how he is answering those questions, whether he is anxious, whether he is emphasizing on certain words, whether he is angry, whether he is not in a mood to reply, he can be kind of secretive, or he is just laughing immoderately. These are the minute observations which you'll make from the beginning till the end of the case checking. So it's a constant active process that you need to do at various stages and correlate with the entire case which is taken by you at the end of the analysis. That will make your job much easier to prescribe certain remedies and at least come to an analysis. So in Helleborus, there is a slow answering when they are questioned, and it's a picture of acute idiocy. If it is chronic idiocy, patient has been like that since many months, then the remedy is Baraitaga. But if it is acute idiocy, think of Helleborus. All these plant remedies will more or less work in acute stages more faster, and you will have a much good response, and the mineral remedies will much act faster in the deeper states of the pathology or the functional changes. Next you have is physical generals for Helleborus, which is sopor sleep with screams, shrieks and starts. So there is someone who gets frightened too soon, which we saw also in belladonna, which we see in opium, which we see in aconite. All these are plant remedies, and if you understand the plant remedies are highly sensitive, all the symptoms that you will get they will express with 2x emphasis on those symptoms, especially those related to their emotions and the nervous systems. You will have someone who is very much shrieking, screaming, and startling by least noises or least movement or activities around them. Greedily swallows cold water, bites spoon, but remains unconscious. So this is a something of a mental symptom or a delirious symptom which is mentioned. It was observed in the provings and subsequently in the clinical observations which the ancient homeopaths have written. If you get a chance to see such cases, you can prescribe on these symptoms. Constantly picking his lips, clothes, or boring into his nose with his finger. We also see this symptom very strongly present in Sina, in Squilla, and of course Helleborus, Arum triphyllum. So Arum triphyllum, we see that they are very much active, very much alert while doing this activity, whereas those who are very much dull or very much in a state of sleepy or they cannot answer too soon, they will require Helleborus more often. So you have to match these components, different components at different levels, and then you will be able to understand how you can use Allen's keynotes in your clinical practice, because in the repertory this is going to be very much scattered and broken in 10 different rubrics. Next you have is dropsy of the brain, chest, abdomen after scarlatina, which is a skin problem and the infectious disease. Intermittents after fever, with fever, debility, suppressed urine from suppressed exanthemata. So all the cases where there is suppressed eruption, urine is not coming out, and there is constant high fever, you can think of Helleborus, provided the other symptoms match. So this all area of when to give remedies in fever, how to give remedies in fever is planned to be discussed in the fever workshop, which is scheduled from 15th of August, which is next week, and there are more than 20 remedies or 25 remedies that I'll be discussing, from chronic polycrest remedies to the acute small remedies, also the intercurrent remedies, when you will prescribe, what you will prescribe, what will be the symptoms, what will be the diagnosis. It's going to be an eye opener for you in such cases where your normal remedies or normal way of thinking has not worked. So those who wish to join, they have all the details on YouTube, on Instagram, on Facebook. They can connect with me, my team, and we'll send you all the details what you require to join the fever workshop. Meanwhile, we are in Helleborus, and further down the line we see hydrocephalus, post-scarlatinal or tubercular, which develops rapidly. So some tuberculous infection which develops too rapidly requires Helleborus to be given. Other remedies being apis, sulfur, and tuberculinum. One more symptom which you will observe most commonly in children is that they kind of bore their head into the pillow or roll their head from side to side. They are setting their nervous system in order to do this, in order to bring it to calm state. They may require Helleborus provided the other symptoms match. They also beat head with the hands. This can be a more deeper state of mental agony or something when their wishes are not fulfilled, or it's kind of a pathological observation which happens also in certain pathological states. Next you have eyes, vacant, thoughtless, staring, eyes wide open in Helleborus, insensible to lights, pupil dilated or alternately contracted and dilated. So in the introduction to fever, which was a free workshop which I conducted last week, and all of you saw that, those who joined, that aconite can be given in cases where there is contracted pupils, and belladonna can be given in cases where there is dilated pupils. In Helleborus, what we see is there is an alternate contraction and dilatation of pupils, and the eyes are wide and thoughtless. Now when you connect this to the state of the mind which we discussed a few minutes ago, which was that they answer slowly, and Helleborus kind of is a very dull remedy, dull patient. you will require lot of effort to ask one question 10 times, then you will get one answer. Sometimes the patient is not registering the symptom because the brain does not have the capacity. That goes in line with their eye complaints or the eye symptoms, which seems to be more objective in nature rather than subjective. And what is the objectivity in Helleborus? There is vacant, thoughtless, staring, eyes wide open. So all this is observation. And if you master your observation, your 60% of the remedy is decided based upon observation. 40 to 50% only is subjective, which the patient tells. Once you kind of develop this habit of balancing the objective and the subjective symptoms, your job to prescribe becomes much easier. This is what should be the aim of homeopath. We always tend to rely on the patients to tell everything to us. It will not happen because they are not in that state that they will be telling you that I am so much anxious. These are all observations, and it is the art of the physician which he will require to elicit. For Helleborus, it is this thoughtless state of the eyes which we need to pick up from the patient and see when you have asked the question whether the patient has replied immediately or has taken time to reply to your question. That will be your prescription for Helleborus. Next, you have the symptom of the mouth, which is chewing motion of the mouth, corners of mouth sore, cracked, nostrils dry, sooty and dry, dirty, sooty and dry, which you can very well observe. Next you have is nervous system, which is brain symptoms are more aggravated during dentition, like the remedies belladonna and podophyllum, threatening effusion. In such cases, you will also have hydrocephalus symptoms or symptoms of increased intracranial pressure. You will see many times that children are getting more hyperactivity, or they become more shrieky, more shouting, more restless, more obstinate, and they become lot of active. The mother tells that they are beyond control. Maybe at times their intracranial pressure is varying, or they are not able to understand what is internally happening. It can be a phase where Helleborus can help them. I have given an ADHD case of child, Apis mellifica, which is one of the complementary remedies mentioned here, and he improved so well that this has been one of the understandings of Apis mellifica which I probably failed in earlier remedies by giving them tarantula, tuberculinum, etc. etc. So you have Helleborus for such cases where there is threatening effusion or increased intracranial pressure, and then you can think of Helleborus. Meningitis, acute cerebrospinal, tubercular with exudation, paralysis, more or less complete, with encephalic cube. Convulsions with extreme coldness of the body except the head and occiput, which may be hot. So you will see similar state in arnica. In fact, you will also see it in belladonna, where there will be one part of the body which is very hot, especially the head, and the other part of the body is very much cold. Next you have is gastrointestinal system, diarrhea, which is during acute hydrocephalus, dentition, pregnancy, watery diarrhea, clear and tenacious, colorless mucus, white jelly-like mucus like frog spawn, involuntary. So there are different states. In fact, if you go and see, there are around 10 to 15 rubrics which can be created out of what is mentioned for gastrointestinal system in Allen's keynotes. But if you just try to understand, there are different states, especially the state of dentition, pregnancy, and the state where their stools are becoming jelly-like and they are also involuntary in nature, which can happen in certain deeper states of fevers and pathologies. So all those cases will require the prescription of Helleborus. Next you have is urinary system. Urine is red, black, scanty, coffee ground sediment, suppressed in brain troubles and dropsy, and there is albuminous urine. So I don't know how many times homeopaths have referred the urine routine reports, investigations, and prescribed the remedy, but if you get a chance and if you want to improve your practice, it's high time that you learn this technique. And the technique is that by seeing the urine routine reports, by seeing the investigations, you match the physical state of the patient and prescribe. For example, what you see over here is Helleborus given for cases of brain troubles, dropsy, and albuminous urine. I have prescribed it in deeper states of diabetes mellitus in cases of children where there was casts in the urine and the albumin was also there and sugar was also there in the urine. Argentum nitricum helped this case. Frothy urine in cases of diabetes, natrum sulf will help. Then there was a case of fever which had a lot of albumin in the urine. It was bordering towards typhoid. The Vidal test was more or less positive towards those titers, which were indicative of the Salmonella typhi being present in the body. That case required phosphoric acid. So in this way, there was a case of septic fever which required which had albumin in the urine and it required carbovage. So if you are willing to take your practice to the next level where patients will bring reports and prescribe, you need to develop that technique. And this technique can be developed by learning the different sources which are our stalwarts have given in the materia medica, in the repertory, and you bring all of them, make your own table of remedies in such cases and be ready to prescribe. That is the only way forward. So for Helleborus, we have urine which is red, black, scanty, coffee ground sediment suppressed in brain troubles, and there is dropsy, albuminous urine. There is automatic motion of one arm and one leg, which we will see mostly in cases of children, especially epilepsy in certain cases, or also in cases of comatose patients where only one part of the body is functioning well and the other is not so functioning well. You will require Helleborus, opium, belladonna, and these remedies which are more often useful. Comparison is the last phase. We come to comparison where there is apis, epocinum, arsenic, belladonna, bryonia digitalis, lachesis, sulfur tuberculinum, and zincum, of which the zincum is more closer to Helleborus in cases of brain or meningeal affections. So we'll take up the next remedy, which is zincum metallicum, and once we open zincum metallicum, we see that persons suffering from cerebral and nervous exhaustion, defective vitality, brain or nerve power wanting, too weak to develop acute exanthemata or menstrual function, or to expectorate, to urinate, to comprehend, to memorize. So once you see, one of the best ways to understand this remedy, and perhaps the most easier way I would say, is that it is there in the alphabet Z. It's the last alphabet. So it will be the last phase of a pathological condition which you will think of this remedy. This is probably much tangential, but something that will come closer to understand it. And in Helleborus we read that there was, after the menarche, after the first appearance of menses, the periods didn't come in the girl, and this can be prescribed Helleborus. Similarly, as an extension of the Helleborus state, zincum met will show you a more deeper state, and that is, it will not bring out the eruption, it will not bring out the menstrual function, to urine, to pass the urine, to expectorate, to comprehend, to memorize. So the all intellectual faculties and the nervous system have all been, kind of in suspended animation. That is where you should think of zincum metallicum. Always feels better every way as soon as the menses appears or begins to flow. It relieves all her sufferings, but they return again soon after the flow series. So this will be required. Once you see that 3 to 4 menstrual cycles, the patient felt better in all her symptoms, But after a few minutes, the after the phase of menstrual cycle ended, the pains and the sufferings increased. That will be the scenario for giving zincum metallicum. Next, you have child repeats everything said to it. So this cannot be just one symptom on which you can prescribe, but it will be something that is, required to be seen in different areas of the patient, the zincum state, and then prescribe. Giving only on one symptom for zincum metallicum will kind of be risky unless you are very sure from the pathological point of view, from the physical point of view, to prescribe, which will take a, years and years of mastery. One of the very interesting symptoms in zincum metallicum is that there is hunger at around 11 or 12 am. Now you make your own landmarks. I have been telling that in many of my sessions earlier as well. In Allen's Keynote Study Street, I have always told that Allen's Keynotes is the best place to make your landmarks. What are the landmarks? For prescribing in uh, cases, you will need some basis to prescribe these remedies. After repertorization, there will be 10 remedies coming, there will be 5 remedies coming. How will you choose what remedy to give? It can be some basis, it can be thematic, it can be physical generals, it can be physical particulars. One very interesting and very reliable way to do this is physical generals and physical particulars. This you will find in Allen's keynotes spread throughout the entire book in all the remedies. For zincum metallicum, it is hunger ravenous, which is at around 4 noon, 11 and 12 am. I have prescribed sulfur to many such patients. Similarly, after eating, if the desire to eat is increased, I have prescribed lycopodium. After breakfast, if they want to pass the stools, or after eating, I have prescribed natrum sulf. I have prescribed bowel nosodes. So in this way, you can make your own landmarks. You can build your own systems to prescribe these medicines based upon the indications in the cases. And there is lot of hurried eating. All the metals that you see, most of the metals will have lot of hurriedness, and that is why you see this also in certain brain diseases of children or certain patients who require to eat very fast. The feet in zincum metallicum are very sweaty. There is soreness about the toes, fetid, suppressed foot sweat, very nervous patient. During sweat, he cannot tolerate any covering. So you will see that when the person is sweating, he will remove off all the covering. If the other states of the patient are matching zincum metallicum, then this can be one of the pointers towards the remedy. In cerebral affections for zincum metallicum, we see that there is impending paralysis of the brain where the vis medicatrix nature is too weak to develop exanthemeter. So we read this already in the first line, which indicated us that there is too weak power in the body. Once the remedy is a metal, it means that it requires a very 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 deep level of arousal to be to come on the surface, to reveal its true features. That is what the metals are all about, the acids are all about, and that is why acids I have kept it for the later part after finishing all the remedies. So metals are one such remedies, which one such group which you will require to think in deeper pathological states where there is kind of a disease which has settled since the last 10, 15, 20, 30 days, 2, 3 months, 6 months, and the pathology has been settled in the organs. That is what happens in zincum med. The cerebral activities are affected, and there are other remedies are cuprum met, sulfur, and tuberculinum. Symptoms of effusion into the ventricles. Child cries out during sleep, whole body jerks during sleep, wakes frightened, starts and rolls head from side to side, which is also what we saw in the Helleborus Niger remedy. Face is alternately pale and cold. This is very much similar to chamomilla and pulsatilla also. Nervous system, convulsions during dentition with pale face, no heat except perhaps in the occiput, no increase in temperature, which is the opposite of belladonna, rolling of the eyes and gnashing of the teeth, automatic motions of the head, hand, or one hand and the head, Epocinum, Bryonia, and Helleborus are the other remedies. Chorea from suppressed eruption and from fright. So you will see all the cases where they have facial convulsions or tweaks and twitches of the certain parts of the face. Those will require zincum metallicum. Single part which has got nervous affections, think of zincum metallicum, especially if it has happened after taking some ointments for skin problems or after fright. Twitching and jerking of single muscles, which is what I told you. Similar remedies we saw a few days ago, just 4 or 5 days ago, we saw agaricus, and the other remedy being ignatia. But in ignatia, it will be more of a emotional disturbance which has caused it, and in agaricus and zincum, it will be more of a pathological state which is causing this. So once you try to understand this from the investigations, from the patient's history, your job to prescribe these remedies will become easier. Last but not the least, we have in zincum metallicum spinal affections, burning whole length of the spine, backache. So the spine is very sensitive in zincum metallicum. We'll see also the case with agaricus. We saw the case with chinnum sulph, china, and there is much aggravation from sitting. Better by walking about. There is a remedy which is cobatum, which is a very good backache remedy. Try to explore it. Another such remedy is macrotinum. You can try to explore it. Is there in the one of the relationships of simicifuga in boric. And the other remedies for such backache which gets better from walking about but aggravated from sitting are pulsatilla and rustox. Spinal irritation, great prostration of strength. So from the beginning of the metal, which is zincum met, which we are studying right now, we see that there is lot of exhaustion, lot of nervous weakness, and there is inability to arouse the power which is required for the healthy functioning of the body, and that is where zincum met can be thought of. Cannot bear back to be touched. I told about chinnum sulph. The other two remedies are also theridion and tarantula. Incessant and violent fidgety feeling in the feet and lower extremities, they will keep on moving their legs. If you have the other symptoms of the zincum metallicum also matching, you can think of prescribing it, and they kind of move it constantly. If they keep on moving only the arms, like how I have been doing, the remedy can be calibrom, the remedy can be, in fact, it can also be Merxol or Heparsol. Excessive nervous moving of the feet in the bed for hours after retiring, even when asleep. So this can be a confirmatory symptom in patients. We can ask them whether when they go to sleep there is constant motion of the legs or the fingers. If it is there, think of zincum as one of the remedies to prescribe. Weakness and trembling of the extremities of the hands while writing and during menses. And there is a very strange position of urine which you need to note, that they can only pass urine by bending backwards. There is chilblains which are painful and aggravated from rubbing. So we come to modalities which of zincum are by drinking wine, which aggravates the symptoms, even if it is a small quantity, which is similar to alumina and conium. And amelioration is by expectorating, by urinating. So bringing out the eruption ameliorates. In fact, lachesis is one of the top remedies which will also feel better by relieving the discharges, by emissions, by menstrual flow. You can see it in zincum metallicum also. So you can compare zincum metallicum to Helleborus and tuberculinum in brain diseases, or it's mentioned incipient brain disease, but I would say more of a recent scenario where we see hyperactive kids, we see more of patients who require anxiety disorder medicines. They should be given these medicines which will work more on the brain and calm down their nerves. Chamomilla and Nux vomica are not suitable to be prescribed with zincum metallicum because of the similarity of action on the nervous system. So that brings us to the end of today's session, where we discussed two remedies. One was Helleborus and the other is zincum metallicum. And those who wish to join the workshop, they can join the fever workshop, which begins from 15th August. And if you have any questions related to fever, connect with me by 9:30 p.m. IST tonight. So I would be more than happy to answer those questions of fevers which you need answer for and prescribe certain remedies for. So that's all for the current session from my side. We discussed two remedies, which is Helleborus and zincum. Do watch again for more information and drop me a comment about what you felt about this session.